Well, hello and welcome to the COVID-19 pandemic update. I'm Kayode Okikelu. First, the highlights. 14 hours to the vaccine mandate enforcement for federal civil servants. Government expands vaccination sites, insists no backing down. The House of Representatives asks the federal government to step up surveillance and enforcement to curb the Omicron variant. And health officials in the Netherlands say Omicron was present there over a week ago. Well, great to be back with all the latest COVID-19 updates for you. It's been a busy past few days, no thanks to the new Omicron variant, but the key word is vigilance and not panic. As at yesterday, no case had been detected here in Nigeria, according to the NCDC DG, Dr. Fedayo Adetifa. But he was quick to add that the situation can change today when results from the samples in the pipeline come out. Well, we're following that lead, and you'll be the first to hear if there's anything new. In the meantime, here's the latest COVID-19 trends.
21 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 6 states, indicating a drop from the figures reported earlier. Lagos logged the highest infections with 6 cases, while Cross River and Rivers registered 5 cases each. Abia recorded 3 cases, while Bauchi and Kaduna had 1 case each. There were no cases reported from Kano and Plateau states. The new tally has increased the total confirmed cases in Nigeria to 214,113. 38 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 207,292. There were no deaths from COVID-19 complications reported in the last 24 hours, leaving the fatality toll to 2,976. Currently, there are more than 3,000 active cases in Nigeria, while over 3.5 million samples have been tested so far. More than 6.5 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while over 3.5 million persons have been fully vaccinated. In Africa, there are more than 8.6 million confirmed cases and over 222,000 deaths recorded across countries on the continent. The total global confirmed cases have surpassed 262 million, while deaths are beyond 5.2 million.
Well, the Presidential Steering Committee on COVID-19 is insisting that the government will not be backing down on the enforcement of the vaccine mandate for all federal government employees. So as from tomorrow, December the 1st, civil servants will now be required to show proof of COVID-19 vaccination before they are allowed access to their workstations. The government had flagged off a mass vaccination campaign over a week ago to expand vaccination sites for more Nigerians to get vaccinated.
The Presidential Steering Committee is aware of some travelers who have resolved to circumvent the travel protocols by providing fake COVID-19 test results, permit to travel certificates, or declaring fake vaccination status at our point of entry. The weight of the law is heavy and will come hard on these people. I get a little bit baffled when people would fake their health status. It's amazing. You can do that with any other thing, but faking a health status, it's a situation that should be avoided at all costs, because the first danger is to yourself.
I would like to remind all federal government employees that starting from December 1, they will be required to show evidence of being vaccinated against COVID-19 or a negative PCR result done within 72 hours before being allowed into their offices. To further ease access to COVID-19 vaccines by these government employees. We have also commenced office-to-office vaccination in some ministries, departments, and agencies. What this simply means is that employees who are yet to be vaccinated will find a vaccination site around their offices to register and get vaccinated.
Barely a day after the NCDC reassured Nigerians that the Omicron variant had not been detected in the country, the House of Representatives is asking the Federal Ministry of Health to mandate a COVID-19 task force to immediately implement strategies that ensuring residents continue to comply with all advisories aimed at curtailing the spread of COVID-19. And this is sequel to a motion by Representative Dachang Bagas on the Omicron variant of COVID-19. The lawmakers are also asking the Nigeria Center for Disease Control to ensure intensive observation and checks on inbound passengers.
Concerned that a total of 126 genomes of these variants have been detected globally and published on GSED, a global mechanism for sharing sequencing data, and there seems to be a high number of mutations present in the Omicron variant and the exponential rise against the virus to be highly transmissible and may also present an increased risk of reinfection compared to other variants of concern. The House resolves mandate the Federal Ministry of Health to mandate the COVID-19 task force to immediately activate strategies to be implemented in monitoring adherence to COVID-19 guidelines and ensure residents continue to comply with all advisories aimed at curtailing the spread of COVID-19. Mandate the Nigerian Center for Disease Control to ensure intensive observation and check to travel protocols for inbound passengers.
So the big question is Nigeria in a good place to combat this new variant? Well, we're joined on the program by renowned virologist, Professor Oyewale Tomori, who joins us from Ibadan, the Oyo State capital. Thank you for joining us, Prof. So there's been very hot global debate on the new variant of Omicron, and that's ironic because very little is known about this variant, and debates are usually on the basis of knowledge and facts. But let's come to Nigeria. The NCDC maintains that we'll be vigilant. The government is sort of holding back on travel restrictions. The National Assembly is saying, well, there needs to be some sort of surveillance. Is that enough for you?
No, it's not enough for me. You know why I'm saying that? When you look at your country and the way we disobey rules and the way we go around and break laws, I was listening to Boss Mustafa saying he cannot understand why anybody will play with his health statistics. And that's the kind of country we're in. So when you know your country, you make laws to take care of that. I'm looking at, I've been listening to the news. MPSCDA says they will be vaccinating office to office. But remember, the vaccine does not take immediate effect. Your immunity does not develop the day you get in the office. So even those they are vaccinating in the office should not come to work until at least 10 days to 2 weeks when they develop immunity. So these are the way we do hard work things, which doesn't follow science. I mean, we just do things, I don't know. I'm just laughing because let me give you some good example. The NCDC says they have not detected. They are correct. They have not detected. But it is because they have not detected does not mean it is not here. And you remember the story about two Nigerians who went to Canada and the tested positive. They were supposed to be coming from Nigeria to the place. So what are we talking about? The fact that your system does not detect does not mean that the thing is not here already.
Well, the Presidential Steering Committee, specifically about those travelers, I said there isn't a direct flight from Nigeria to Canada. So, I mean, they say until they are sure about the travel history of those people, it can be said that they came immediately from Nigeria to Canada and they came with that virus. But that aside, Prof, I mean, you have talked about the fact that you think that this is not enough, the measures you have seen. So what more would you like to see? Are you thinking of maybe a travel ban, as we've seen in other countries, or something more stringent? What exactly should we be doing?
For example, thank you very much. When you are saying it's 3-4 days now, my country says they don't know the travel history. What have we been waiting for by now? And the fact that there's no direct connection with Canada does not mean I can get into New York today and then get straight to Canada. the same day. So what are they talking about? Getting to Canada from, you can be on the same flight. CDC, Delta will take you to Atlanta, and the next hour you are in Canada. So let's not bring that up. I mean, so this is the point I'm saying. A country that is proactive will have gone after those information through the Canadian High Commission or whoever it is that is in charge. Get further information on that and stop depending, just like you say, stop arguing on lack of knowledge. Now you're asking me the question. Even we are blaming the Western world for putting bans. Some African countries have put ban on travel. Rwanda has done it. Angola has done it. Those are people who are close to them. And you see, so for me, I mean, Ramaphosa is coming, and they're saying, oh no, they're going to do that. But what is the rule about people coming into the country? When you come, if you are vaccinated, you see tested on the second day. Suppose you are positive on the second day. And suppose they are part of those people coming, what do you do with such people? And you have a 3-day meeting, you're waiting for 2 days to test them. Suppose he comes out positive on the second day, what do? Do you throw away all the people who have been meeting with him? So the best thing would have been postpone this meeting, forget all the information that's available about it before, and locking of the gate is a temporary measure. It's a stopgap to get you for more information. Like some of the things our PSC is saying that, oh, these people travel to Canada and something, they don't know whether it's a straight travel history. It takes you less than 24 hours to get to Canada from Nigeria. So don't bring that type of thing up.
I think the concern here, because the WHO has actually spoken against some of these travel restrictions, and they're saying it shouldn't be discriminatory, so people will not be tagged. Imagine people calling it the South African variant, for example, which is why they had to come up with another form of naming system, so you don't tag it to a certain area or certain people. So that's the fear. I mean, we don't know what might happen in the future, such that this does not become discriminatory. So how do we balance this? I mean, you seem to say that even the South African president should not be exempted from these protocols.
Of course, and that's what I'm saying. It is health for all of us. The fact that you are president, diplomatic immunity does not give you vaccination immunity. We are all human beings. Your position doesn't make a difference. This is a virus that's affecting everybody. Now, let's go back to the issue. Yes, WHO issues guidelines. Countries can abide, but each country still takes its situation in its own country into consideration. You look at the situation in your country. Yes, WHO has guidelines. That's the ideal thing. But then I have a different situation in my country, and I look at WHO guideline. It's supposed to guide me. It's not supposed to force me to take a decision. And then when you look at the list, I've just checked the list of now, there are 38 countries that are banned from in South Africa, ranging from Thailand to Angola to Rwanda. African countries are banning. So what are we talking about? Where's the discrimination?
I mean, big issues you have raised, Prof. But I imagine you've also perhaps seen some preliminary information or findings about this variant. From what you know, does this look like a beta variant, which we had, that there was some buzz about it, but it didn't turn out as virulent as expected? Or do you think this is like the Delta variant, which ended up taking the world by storm?
You see, unfortunately, like we're all living in ignorance. Even 2 years after the epidemic has occurred, whether you're from the West or you're from the East or from the North, we're all living in ignorance. This virus is a very smart virus. It's coming up with different things at different times. Like you said, this may be unnecessary hype. It may turn out not to cause any major infection, but you don't know. So you take precaution in case it turns out to be Delta or more than Delta. So you cannot take the risk and say, oh, the thief that came last night, you only carried a cutlass. I'm sure the next one is not coming with a gun. You still prepare, whether it's cutlass or gun. And this is the point I'm trying to say. Given a country where we have a little bit of problem with complying with regulations, given the porous border that we have because of our penchant for doing the wrong things, the right thing, I would put a law that would take all that into consideration. Let me ask one very interesting question. Those countries where they abide by the law, how many mutants have come from there? Just check. Even in China, where the original thing came, how many mutants have you got from China? How many variants have you got from China? So the solution is we are the ones that create the variants by allowing the freedom of the virus to move from one person to infect people. If you wear your mask, if you keep that virus at bay. They call it mobile phone. Your phone is not mobile, is it? You carry it around. We are the ones carrying this around and causing all these mutations. So abide by those things, and we be a better and safe place for everybody.
Prof, it looks like we have to continue this conversation sometime soon because, I mean, as you may have seen now, the Omicron variant was said to have been in the Netherlands a week before it was even discovered. So can we really say that this variant is from a particular place? But we're out of time, Prof, but we'll definitely do this sometime soon. We'd like to thank you so much, Professor Oyewale Tomori, renowned virologist. Thank you for your time this evening.
My pleasure, sir.
Well, we'll go on a break now. And when we return, we'll take a look at the situation, not just in the Netherlands, but particularly in the United States, where President Joe Biden says, well, lockdowns are ruled out, at least for now. Just stay with us. Well, you're welcome back. The Cross River State Governor, Professor Ben Ayade, has suspended the 2021 Calabar Carnival as a precaution against the Omicron variant and the prevailing security situation. Speaking during a briefing at the State Executive Council chamber, which was attended by Carnival band leaders, members of the State Executive Council, and local government chairman, Governor Ayade said he will not, as a governor and leader, compromise the lives and safety of the citizens for the fleeting excitement of the carnival.
The Carnival Calabar for 2021 is suspended on one condition. However, I wanted to test our capacity to organize a carnival even in the shortest time. And I wanted to give my right eye to prove that we can still do a fantastic carnival. But the reality is that what if this variant comes like any other variant and comes with a win and goes? In the event that I have a contrary opinion that this is just a scheme for use of decent word, if we have reasons to believe that this variant, because they have said it's mild, they have not said it's very particularly deadly. They have reasons to believe to the contrary. Even if it is 1 week notice, we will hold a carnival. So that you know that the intention is there. Like somebody said, if anything goes right, we all get the applause. But if it goes wrong, Ayade will be brought to the wall for crucifixion.
Well, outside Nigeria, U.S. President Joe Biden says he sees no need for a new lockdown as North America detects the Omicron COVID-19 variant. He calls the variant a cause for concern and not for panic, especially if people are vaccinated and wear their masks. Cases have been found in Canada, and the U.S. has imposed travel bans on 8 southern African countries. Mr. Biden added that pharmaceutical companies were making contingency plans for new jabs. That's if they are needed.
The very day the World Health Organization identified the new variant, I took immediate steps to restrict travel from countries in Southern Africa. But while we have that travel restrictions can slow the speed of Omicron, it cannot prevent it. But here's what it does. It gives us time. It gives us time to take more actions, to move quicker, to make sure people understand you have to get your vaccine. You have to get the shot. You have to get the booster. If you're, sooner or later, we're going to see cases of this new variant here in the United States. We'll have to face this new threat just as we face those that come before it. Today, there are 3 messages about the new variant that I want the American people to hear. First, this variant is a cause for concern, not a cause for panic.
Well, let's now join our Washington correspondent, Maria Bird, for more on this. Well, we'll talk about the Omicron variant in a moment, Maria. But first, what's the COVID situation in the U.S. today? I mean, this time last year, the country recorded over 160,000 daily cases. But what's happening now, Maria? Okay, I understand that we've lost Maria, but we'll try to reconnect with Maria. In the meantime, let's bring you more updates on the new variant and the pandemic situation in other countries. Here's a global update.
The new COVID-19 variant Omicron was detected in Europe earlier than previously thought, with Dutch health officials saying it was present in the Netherlands over a week ago. The variant was present in samples taken between 19th and 23rd November before it was identified in South Africa. The first Omicron cases in the Netherlands were thought to be 14 infections on 2 flights from South Africa to Amsterdam on Friday, November the 26th. The head of the EU's public health agency says 42 cases of the Omicron variant have been confirmed in 10 European Union countries. EU authorities are analyzing another 6 probable cases. Japan has confirmed its first case of Omicron in a visitor who recently arrived from Namibia. His travel companions and passengers in nearby seats have been identified and have been reported to Japanese health authorities for follow-up. And finally, Australian authorities have confirmed that a person who flew into Sydney on Thursday was infected with Omicron. The fully vaccinated person visited a busy shopping centre in Sydney while likely infectious.
We will put a pause on the next phase of international arrivals, which would have commenced on the 1st of December. In particular, those arrivals with regards to the students and working visas and other related categories, which were going to commence on the 1st of December, will now commence on the 15th of December. We're doing this out of an abundance of caution, but our overwhelming view is that whilst it's an emerging variant, it's a manageable variant.
The additional case brings Australia's total number of infections with the new variant to 6.
Well, elsewhere, British Prime Minister Boris Johnson says it is likely that COVID-19 vaccinations will increase protection against severe disease from the new Omicron variant, even if effectiveness against infection is reduced. All adults in the UK are now being offered boosters, and the NHS says people will be called in priority order.
Risks. The answer is everywhere and always to get the booster, because we think that it's overwhelmingly likely that the booster, getting vaccinated will give you more protection. I think what Stéphane Bancel was saying is probably right, but you need to look at what he's not necessarily saying that this will mean that the vaccines are ineffective against serious illness or death, and they may be less effective in preventing transmission. We see some evidence from South Africa that it's the virus Omicron is transmitted between people who have been vaccinated, but it's not clear to what extent this means that you're going to pick up a severe case of Omicron, or that will have a problem with serious illness and death. I know that people will be thinking, have we got to make another great surge like we did earlier this year? And I'm afraid the answer to that is yes. And I just want to say that we'll throw everything at it. And I hope that we can do the same thing again, because everybody can see the situation. We've made a huge amount of progress against the Delta version of the virus, of coronavirus. We now have this question about the Omicron variant.
Speaking of vaccines, the EU drug regulator could approve COVID-19 vaccines that have been adapted to target the new variant within 3 to 4 months. That's if it's needed. Speaking to the European Parliament, the Medicines Agency, the Executive Director, Emma Cook, says it is not known if drug makers will need to tweak their vaccines to protect against Omicron, but the agency is preparing for that possibility.
There will be a mutation that I think it's very important that we continue to give the message that the current vaccines provide protection, and we need to ensure that those who are eligible for boosting get the booster doses. At the same time, we need to prepare in case there is a need to change the current vaccines, and that's work that the companies will do. We could be in a position that were there a need to change the existing vaccines, we could be in a position to have those approved within 3 to 4 months. That's from the start of the time when they would start to change. But a decision needs to be made first whether that's necessary.
The review in 2026 for this. Well, it hurts that we couldn't bring you our Washington correspondent, Mario Bird, but tomorrow is another date, so keep a date with us. That's our COVID-19 update. Thank you for watching, but do remember to visit our website, channelstv.com, for more updates and a better understanding of the pandemic, plus other stories, all at your fingertips. You can see the federal government maintaining that there's been no detection of the new Omicron variant just yet in Nigeria, plus other breaking stories. Thank you for watching. I'm Kayode Okikulu. Goodbye.